currently doing my MSc in Childhood Nursing at SDM University, Dharwad. The newborn infant physical examination must be performed within 72 hours of birth. The purpose of the examination of the newborn is to screen for congenital abnormalities, to make referrals for further tests or treatment, to provide reassurance to the parents. Here are some of the guidelines which you should know. The room should be warm and with natural light. Always make sure that the parents are present for the newborn check, as this is an ideal time to answer queries. The optimal way to perform the newborn check is by examining from head to toe sequentially. In fact, it is an opportunistic examination. If the baby is settled, listen to their heart first. If they open their eyes, check the red reflexes. And if they cry, look at the palate. And also, encourage the parents to ask questions during the check and to participate where appropriate. Articles required for newborn assessment include a TPR tray to check the temperature, a sphygmomanometer to check the blood pressure, a stethoscope to check the newborn heart rate, a watch to check the pulse and respiration, a torch for visual inspection, a measuring tape for anthropometric measurements, a otoscope for the inspection of ear, an ophthalmoscope for the inspection of eye, a pair of gloves, and an infantometer. Wash your hands thoroughly before examining with all the steps. Congratulate the mother. Introduce yourself to the mother, including your name and role. Confirm the newborn's name and date of birth. Gain consent from the mother. I am Sheryl Fernandes, a registered nurse practitioner. So today I need to carry out a routine head-to-toe examination of your baby. And for that I need some information regarding your baby. Is that okay with you?
Okay.
Thank you. So may I know your name?
My name is Deepa.
So Mrs. Deepa, when was the baby delivered?
3 days back, ma'am, on the 1st December 2020.
May I know the gender of the baby?
He is a male baby.
Okay. What was the weight of the baby at birth?
It was 3 kg.
Oh, that's great. Did the baby cry immediately after birth?
Yeah.
Okay. Did the baby pass urine or stool within 24 hours?
Yeah, ma'am.
Is the baby breastfed repeatedly?
Yeah, I will feed within 2 to 3 hours. I will feed.
Oh, that's great. So, adequately expose the baby for the assessment. Ask the parents to undress the child down to their nappy. So, can you undress the baby for me?
Yes, sure, ma'am.
Thank you.
I need help, ma'am.
Yeah, sure. Started crying. Yeah. Can I take this? So now let's check the weight and length of the baby. The baby should be weighed in a naked condition using a weighing machine. First, check the scale to be 0. Then place the baby on the weighing machine. The weight of the baby is 2.8 kgs. Now let's check the length of the baby by using the infantometer. Place the baby in a supine position and slightly press his knees to obtain maximum extension. Take back the baby and hand it. Here, the baby's length is 50 cm. Moving to head circumference, it is measured on the occipitofrontal plane. By using a tape, can you just hold the head? So head circumference of the baby is 37 centimeters. Now let's note the chest circumference. Can you please lift up the baby?
Yeah, sure.
It should be measured
at the level of nipple.
Can you please lift it? Thank you. So, the baby's chest circumference is 34 centimeters. Vital signs. Vital signs should be examined when the baby is quiet, without crying and in between feeds. First, let's check the temperature. It is usually measured in the axilla or the rectum. Also, note for the respiration rate. The breathing may be thoraco-abdominal, periodic and regular. So, the normal axillary temperature is 36.5 to 37.4 degrees Celsius. The baby's temperature is 36.5 degrees Celsius. Respiratory rate is normally 30 to 60 breaths per minute and the baby's respiratory rate is 34 breaths per minute. So now let's auscultate the heart rate. The normal heart rate is 100 to 160 beats per minute and the baby's heart rate is 140 beats per minute. Now let's check the blood pressure. An appropriate sized cuff should be used to check the blood pressure in newborn babies. The normal blood pressure of the newborn is 60 to 40 mm of Hg and the baby's blood pressure is 60 to 40 mm of Hg. Now let's start with head to toe examination. Starting with head, inspect for the shape and size of the head. Note for any abnormalities. Also, inspect for the cranial sutures and note if they are widely spread. The head is inspected for the shape and size of the head and note for any abnormalities such as microcephaly or macrocephaly. Inspect for the cranial sutures and note they are widely separated or normal. The newborn may undergo molding during the delivery, which can result to caput succedaneum. It also resolves within a few days of life. We can also inspect for cephalohematoma and craniosynthesis. Assess the fontanelles. Palpate the anterior fontanelle, which is usually open, soft and flat at birth, and note if it feels sunken or bulging, which may indicate hydrocephalus or dehydration. It usually closes between 7 to 19 months. Also inspect for posterior fontanelle, which is often a fingertip size or just barely open. It closes between 1 to 3 months. To assess the skin, it is very important to document any birthmarks or bruises from the birth trauma found on the initial examination. First, inspect the color of the skin and note for any pallor, cyanosis, erythema, or jaundice. Also inspect for the tiny crests which appear on the face and resolves within the first week of life, that is called as milia. Coming down to face, inspect for any dysmorphic features of the face such as Down syndrome. Also look for facial asymmetry and note if any facial nerve palsy. Coming down to eyes, inspect the eyes for the evidence of erythema. Inspect the sclera by gently retracting the lower eyelid, noting for any discolorations such as jaundice or subconjunctival hemorrhages. S is for the red reflex in each eye. By using ophthalmoscope, assess the child's eye by shining the light on the eye at approximately 1 arm's length. Observe for the reddish or orange reflection in each pupils. S is for the ears. Can you please help me?
Yeah, sure.
Tilt his head to my side. So, S is for the sight and shape of the ear. Inspect the pinna. Note for any asymmetry, skin tags, pits, or the presence of accessory auricles. Coming down to nose, assess for the pinched nostrils and a flat nasal bridge. Also inspect to assess the patency of nasal passage. Mouth and palate. Look for the clefts of the hard or soft palate by gently inserting your gloved index finger into the newborn's mouth. On the anterior portion of the mouth, you will feel the hard palate. As you move backwards, you will feel the soft palate. Note for the size and position of the tongue. Look for the evidence of the tongue tie, which is known as ankyloglossia. Look for the presence of the natal teeth. Neck. Inspect the length of the neck and note for any abnormalities such as webbing, which is usually seen in the Turner syndrome. Assess the clavicles. It should feel smooth without any crepitous breaks that may be due to shoulder dystocia. Chest. Inspect for the shape of the chest. Does the sternum lie flat or is convex, that is pectus carinatum, and concave, that is pectus excavatum. Note the position and form and contour of the nipples. The presence of accessory nipples and widening of the nipples may be seen in Turner syndrome. Auscultate the lungs anteriorly and posteriorly. It should sound equally loud with clear passage of air with no wheezes or crackles. Heart. Auscultate each area of the heart with the bell and with the diaphragm. For low pitch sounds, auscultate the heart with the bell. Note for any gallop sounds. Also, auscultate for the high-pitched sounds with the diaphragm. Note for any pericardial rubs or most of the murmurs. Abdomen. Inspect for the evidence of abdominal distension due to bowel obstruction, organomegaly or ascites. The umbilical cord should look clean and dry. Inspect for the umbilical cord for any swelling, erythema or discharge. Next, palpate the newborn's abdomen to assess organomegaly by placing one hand on the other, pushed gently by 1 to 2 centimeters. Palpate around the abdomen carefully, assessing for masses where some newborn may have intra-abdominal neoplasms. Groin. Inspect for the evidence of inguinal hernia. Evaluate the genitalia. In male genitalia, assess the testicles, which may be descended by palpating them. Assess for the swollen scrotum or large scrotum, which may indicate hydrocele, that is, fluid collection around the testes. Examine the penis for any abnormal curvatures. Hooded foreskin is often indicative of hypospadias, that is, the ventral displacement of the urethral meatus. In female genitalia, the labia and the clitoris may appear engorged as a result of maternal hormones. Also, assess for any vaginal discharge or bleeding. In all infants, assess the patency of the anus by gently spreading apart the gluteal cleft. Extremities. First, assess the hip. Assess the range of motion at the hip joint. Note for the evidence of hip dysplasia, that is, a congenital deformation or a misalignment. Assess the hip by using two manual, that is, Barlow's manure and Ortolani manure. In the Barlow's manure, first abduct the hip by bringing the thigh towards the midline and then apply a gently posterior pressure on the knee. In Ortolani manure, flex the infant's knee to a 90-degree position, then abduct the legs by folding the thighs outward. If you found a clunk or a dislocation, a follow-up care should be done with the physician. Upper and lower extremities. Assess for the polydactyly, syndactyly, clinodactyly. Note the form of the creases. Assess the symmetry of the upper extremities and the lower extremities. They should appear equal in size and shape. Back and spine. Now, gently turn the newborn over to inspect the back. Look for bluish colored pigmentations over the buttocks or the back, which are known as Mongolian spots. They disappear within the first year of life. Also inspect for languor, which are fine, soft, immature hair, which are seen normally in newborns. Assess for the sacral dimple. If it is visible, then the baby may have spina bifida occulta or the tethered cord. Neurologic reflexes. First, the Moro reflex. To test the Moro reflexes, hold the infant and pull forward until a few centimeters above the bassinet. Drop the newborn's head gently into the other hand. Her hands should open and upper extremities should extend and then retract. This reflex tends to disappear from about 6 months of age. The Palmar reflex. It is easily done by keeping your fingertip into the baby's palm. The baby should wrap his or her fingers around yours. This tends to disappear for about 4 to 6 months of age. Next, the rooting reflex. It is done by stroking the newborn's cheek, leading her to start suckling the mouth in anticipation of a feed. It tends to disappear for about 4 months of age. Sucking reflex is just a rooting reflex. So, when something touches the top of the infant's mouth, the infant will begin to suck. This tends to disappear at about 4 months. Babinski's reflex. This is seen when the bottom of the foot is stroked from the heel upward along the outward part of the foot. The big toe dorsiflexes and the other toes spreads out. This tends to disappear at around about 1 year of age. After you complete your examination, re-swaddle the baby by placing the baby on top of the blanket. Wrap one corner of the blanket around the body. Hold the bottom of the blanket upward to the chest and finally tuck the other side of the blanket around the baby and beneath the back. Thank the mother for allowing you to examine the newborn and ask if any queries. Thank you, Mrs. Deepa.
Welcome.
Wash your hands and summarize the findings. To summarize the findings of the newborn, my client, baby of Deepa, has normal texture without any pallor, sinuses, erythema or jointness, and there is absence of milia and bruises on the skin. Head of the newborn appears to be normal without any abnormalities. Both anterior and posterior fontanelles are open without any deformities such as sunken or bulging. Face is symmetrical in size and shape without any dysmorphic features. Eyes are normal without any conjunctivitis or any discharge. Shape and size of the ears are symmetrical. Nose appears to be normal with normal patency and nasal bridge. There is no evidence of cleft lip or cleft palate and normal positioning of the tongue can be seen. Neck appears to be normal without any lumps or webbing. Chest appears to be normal with no any deformities and there is no accessory nipples found. On auscultation, breath sounds were heard normal without any wheeze or crackles. While auscultating the heart, there were no any murmur sounds or pericardial rub sound. On inspection of the abdomen, there is no evidence of any distension like ascites. The umbilical cord appears to be clean and dry. On palpation, there were no evidence of organomegaly or any masses like neoplasms. The groin region appears to be normal without any inguinal hernia. Though it's a male baby, the testicles were descended and there are no any signs of hydrocele or hypospadias. And also, the patency of anus appears to be normal. The range of motion of the hip joint is not dislocated and is normal. By performing the Barlow's maneuver and Ortolanis maneuver, there were no any clunk sounds or any dislocation found. The upper and lower extremities are normally found with equal size and shape with no evidence of any deformities like polydactyly, syndactyly or clinoractyly. In neurological examination, all the reflexes such as Moro reflex, palmar reflex, rooting reflex, sucking reflex, Babinski reflex were all found normal. Therefore, this is how the newborn is being assessed. I conclude my newborn physical examination here.